us and our tribal council, is that we have a group that was formed specifically to stop us. I mean, I originally spoke to the leader, Jody, like the first month in July of 2019, and said, can we sit down with coffee and talk about how we could work together to make this a safe and successful clinic? And she told me, I have no intention of doing that. I intend to stop you. And so it's very hard for us to say how we would enter into a monitoring program and trust that people were using it to really make the community better and not to just keep coming at us.
Right. Yeah.
That we, and blaming us for things that we didn't cause. I mean, there's people already saying we're responsible for the homeless, and we haven't even opened up the clinic yet.
Right. Yeah, I understand that. But I mean, of course, if such a situation were put together,
I'm going to object here. I'm sorry, he's getting off in a little more than name calling now.
I didn't call anybody a name.
Okay. Yeah. Well, I'm sorry. I didn't hear anything too personal in there, but let's be careful about that. We're all very sensitive about what we're discussing here. Yeah, I mean, in this situation, though, it would be of course, the city, not the organization that was created to stop you, that would be kind of responsible for enforcement, and you would have recourse to the courts if the action items weren't carried out as originally intended. So there would be more safeguards than what you're worried about. But anyway, I'm just throwing that out, and I will say, I'm being placed in an odd situation as a decision maker here because a lot of this agreement is voluntary, right? So either it seems to be an all or substantially less proposition potentially, where if I do find it's part of my job, if there happens to be something that's not mitigated correctly, I'll have to impose some mitigation for that. And if I do that, then the tribe can say, fine, we're going to withdraw all our voluntary agreements then, and the net result could be something far less. And so it would be nice, before the hearing is closed, if we, can agree on something like a monitoring plan that would be mutually acceptable to everybody, so that I can look at the whole package and say, okay, this eliminates any potential concern I have, and I feel confident moving forward with it. But
well, Mr. Albrecht, if I could add to that, one thing I would say is that when we talked about having this advisory committee, we talk about sharing data. We're not obligated, and a lot of clinics don't share data. We're willing to share data that we can within the reason of HIPAA. One of the things that makes a hard monitoring program in healthcare is nobody has a track of any numbers. We don't really know how many homeless people are out there. We don't really know who's addicted to what. And the reason we wanted to fund this social navigator is so we could get a handle on some of these things. Our biggest fear of a monitoring program would be that we would start being blamed for things that we weren't responsible for. That doesn't mean we don't want to help with those things. It just means I want to get a handle on numbers. We've said at our annual report that we're going to do yearly, we'll put out the numbers. Here's how many patients, here's how many dropped out. And then we can start to make guesstimates on what's happening. But until you actually get out and like Seattle's had the same problem. They don't know where these people come from. They don't know what they're doing. I mean, I would like to get a handle on that through the social navigator and some sort of community group that got together and talked about everything together, and not made it a monitoring program that blamed us for every social program or problem that happened in the city.
Right. No, I can see your concern. I think, a lot of that could be addressed in detailed enough drafting, but I'm just throwing it out there because, again, when all this is said and done, I'm going to be placed in that sort of all or substantially less, where if I, as my duty, if I find something that's not mitigated and I require that to be mitigated, then the whole deal falls apart at that point. And I want to avoid that. And a mitigation plan would pretty much sew up a lot of anything that could go wrong, up front, so that I could just find as in my final decision that everything is good the way it was agreed to, But so again, I'm just trying to provide some incentive to the parties to try to, throw in a monitoring plan as part of their final deal to make it easier for me to come up with a decision that best suits the community. That's just thrown out there. Let's see.
Mr. If I may, this is Christina with the city. I just wanted to bring your attention, and I think this is what Mr. Simkoski was alluding to a little bit earlier when he was talking about sharing data. The city funds a coalition of human services called the Sequim Health and Housing Collaborative. It's something that we started, I think, to Mr. Simkowski's point, COVID compresses everything. I think it started a couple of years ago, and it is exactly that. It's a coalition of the food bank, of domestic violence and healthy families resources, Peninsula Behavioral Health, which is one of our mental and behavioral health facilities. And we've got, I think it's in the neighborhood of 8 entities who are working together and in conjunction with this navigation program and the kind of a community monitoring program. Chief Crane can talk about this a little bit more tomorrow if you're interested, but Mr. Simkowski, that may be what you're talking about in sharing data. That was one of the big hurdles that the SHHC had to overcome, was the fact that none of these healthcare providers were sharing data with one another. And so that's been a big force. And so they are working on how to share data that is HIPAA compliant, how to work together without overlapping scarce resources and then trying to fill in those gaps. So we have a lot of those things in progress already. And I just wanted to make sure that the examiner had some knowledge of that in case you wanted to have a little bit more information about that tomorrow.
Okay, thank you. Yeah, that helps. Thanks. All right. I don't know how many questions we've got done so far, but let's see. And we're up to 50 total at this point.
I could have been retired by now.
yeah. This is not an easy way to make a living, not right now.
Oh my gosh.
Okay, well, all the rules that the city is imposing deals with inside the facility, what mitigations will there be for homeless, drug dealers, et cetera, outside the facility?
Well, again, there's homeless people in this town, there's drug dealers in this town. We're not responsible, or we didn't create them. Now, would we like to help get rid of them? Sure. But people want to take the problems that already exist here and say that we're going to be responsible for those in the future. That's the thing we worry about with any kind of program, is that we're going to get blamed for every social ill that happens in Sequim, whether it has anything to do with us or not. If we know about any drug dealers, or if we know about anything like that, we're going to report it all to the police.
Okay. Next question. Why are there all these people purportedly wanting treatment not going to existing clinics?
Well, because one of the big reasons that we want to start this facility is that there are certain folks that need more intensive services, that the other programs did not work for them as well. Or there's people that are just too scared to even start because they don't think the program will work. We've had a lot of people say that they're scared to even start because they don't think they're going to be able to make it. They don't think there's enough counseling. There's not enough help or support around them. So this is going to offer that to those folks.
Okay. Next question. It sounds like the clinic will require a large number of employees. Will the Sequim labor pool support that? If not, won't the clinic compete for trained personnel at the local hospitals? And that's outside the scope of the appeal, really. Next question. Please explain the section of supportive housing then that is shown on the permit application. Do you still maintain that you do not and never did plan to build housing for the homeless? Please speak about the supportive housing project in place at the Digwalik Center in Anacortes.
Yeah, I don't know where this housing, I just saw, I had a business 2 weeks ago just give me a handout that the SOS was handing out. And it said that, among other things, we were building a 40-bed expanded mental health hospital that we've never talked about, and that we were going to build Section 8 housing. I don't even know what Section 8 housing is. I have no plans to build any housing. We built housing at the tribe, but it's for tribal citizens.
Okay. And what day of the week and time of day was Mr. Benedict there at Digwalik? Was this during normal or peak operations time?
I don't know exactly. I think it was the middle of the week, and I don't recall, but he was there for a while. He sat out in the parking lot, and then he went inside and got a tour. And then he drove around and talked to different people. And so that's all I could tell you about that without asking Sheriff Benedict.
Okay. And I'm just going to read the next one. And why does it have to be in Sequim? Why are there all of a sudden 100 new homeless living in our parks and under the Dungeness Bridge? Why are Safeway and all the markets have an uptick in theft? You've already answered questions about why you picked the location, and I think it's beyond your expertise is why there's a homeless problem in Sequim right now, if there is one. Let's see. Okay, this is another really a comment about the tribe needs to provide some financial guarantees. Next question. Are the MAT patients Jamestown is now paid for by Medicaid?
Well, they could be Medicaid, Medicare reimburses for those services, and so does private insurance. So they could be all three.
Okay. All right, still reading through comments. And I think the next one is just asking why the composition of the committee was changed, and you've talked about that. Okay, and the next question is what happens if our fears materialize? What legal recourse do we have against the tribe? I don't know if you can answer that if you want.
How can
really lawyers? I guess the more broad question is how can you hold the tribe accountable if it doesn't follow through on its promises?
Well, we don't have a history of not following through on our promises, and so we put a lot of things. Most of the stuff that we've got in here, we volunteered to do. Walmart didn't have to do this, and Home Depot didn't have to do this, and Costco didn't have to do any of these things. So we think we're showing a lot of dedication to the community by volunteering these. Now, do people want more? I get it. There might be some other things that we can talk about down the road. We're still, at the very earliest, we wouldn't be opening until around 2022. Construction would take a year. And so there's a lot of time to talk to the community. I just want people to trust us and believe us when we say that we're not going to do anything that's going to harm the town, and then go from there.
Okay. The next question, it kind of assumes facts not in evidence. They make some assumptions. I'm just prefacing it because it's a little inflammatory. What do you think are the long-term consequences of the racism the tribe has experienced from SOS? And second question, what will you do to protect the patients from community members should they start photographing, harassing, following patients, documenting vehicles, etc.? And I'll say up front, this person believes that SOS has been racist. Nobody is, I'm certainly not asserting that, but in terms of, I think the broader question is, will this affect relations with the tribe and what's happened through this process, and what are you going to do about protecting people who might be harassed by community members who visit your clinic?
Well, a couple of questions there. One is, has this done harm to the community? Yeah, all we said we were going to do is help people. And so we don't believe we've created the harm by doing that, but it has created that. I think the politics in this country are such right now that those on the far extremes on both sides are at each other. And it bothers me that Sequim in our area, I mean, you may not know this, Mr. Albrecht, but we've voted for the president in every election since 1980. We're one of the few counties in the country. So in the last election, we voted for President Trump, and in this election, we voted for President-elect Biden. And on very narrow, I think 5% this time and maybe 4% last time, something like that. But all that means is that there's a lot of different viewpoints in the community, and it bothers me a lot. I never really intended for this to create such animosity in the community. And I wish in hindsight we could all sit down and talk about this more, because I think what we're really doing is beneficial to the community. I understand the fear, and I'm really concerned about patients. We had some reporters coming in and asking us, could you get any of your patients to talk to us for a story? And every one of them told us they were scared to death because they didn't want people to know they were in the program. And again, this is that whole stigma. I mean, every time something bad happens in this country, we say, well, there's not enough mental health services, and there's not enough behavioral health services. And yet the minute somebody tries to do it, everybody screams, not here. And so that does bother me. Now, that being said, I'm willing to, sit down with people and forget the past. I don't live in the past. I don't hold grudges. Sit down and let's figure out how to move forward. And we've offered that, and I still offer it.
Okay, thank you. next question, you waived immunity to get the sewer built. Why are you obscuring this reasonable request? I think you answered that. This is the sewer was contractual. This is permitting. Is that what it boils down to?
Yes, that's
Okay.
correct.
Okay, the next one is something just you answer if you're inclined. Regarding city ability to collect taxes from the tribe rather than the tribe providing funds at their discretion instead of being taxed, what assurance do the businesses and city residents have that taxes will not be increased to support additional potential city services needed due to the clinics, since assumptions were made by, okay, yeah, well, that's the question.
Yeah, well, I mean, first off, that we offered up that bond, if we can find one, that if, you know, if there is an impact to services, then that goes into effect. We don't think there will be, but you know, the tribe is we donated fire trucks to the fire department. We've paid for cars for the sheriff's department because if we thought there was any impact to anything that we provided, and if we find that there's any impact to our clinic, we'll help with those services. And we have in the past. So, I mean, when people say what assurances, just look at our history.
Okay. Next question. This questioner asserts 90% of the town has asked that the clinic be placed somewhere else. The tribe isn't listening. You know, why? That's the question.
Well, I mean, I guess I would say that we picked land that was zoned for healthcare, and this idea that I will tell you that I don't think that the group that's opposed to us today is the majority. They say 90% say this and the majority, but if that was the case, any of the opponents that were running for, any of the candidates that were running for elected office in the last 2 years that were against our clinic would have won, and none of them have won. In fact, they've all got beat pretty badly. And so to say that they're a majority or 90% believe this, it's not true. Unfortunately, Facebook and social media makes it where you hang out with everybody that thinks like you think you're the majority. And so I would say that it's not the majority of people that think that. We have the support of every healthcare organization in 2 counties, all of the community-based organizations. And there's really only one group that's opposed to what we're doing.
Okay. Next question assumes facts, not in evidence. Why is there a waiting list for the Matt Clinic when we already have 6 times the capacity for Matt care on the Olympic Peninsula? Of course, the first preliminary question is that correct? There's 6 times the capacity on the peninsula.
Yeah, again, that's that misleading number where you look at the number of certifications that a provider has and you think that's the capacity, and it's really not.
Okay. I mean, if I recollect correctly, you were saying that you were at at least the Anacortes.
Oh, you mean the capacity of our clinic? Okay, I misunderstood the question then.
For Matt care in general, they said, yeah.
Well, yeah, Matt care in general is they look at that number where all the providers that went out and got the certification that allows them to see up to 100 or 150 patients. If you multiply that out, it comes out to like some huge number. And the fact of the matter is, many of those providers aren't seeing any MAT patients, and they don't intend to. They just wanted the certification.
Oh, okay. So I mean, did you testify earlier? There was I mean, you're doing this because there's a need for it, right? And you're
yes. Oh yeah. We believe there's a huge need.
Okay. Let's see. Well, the next question: will the new clinic serve methadone? Does the Fifth Avenue Clinic deliver methadone for opioid treatment specifically? What are the differences in licensing?
Well, the clinic here is not serve methadone as a daily dosing clinic. That does require a different license through Department of Health. That's the one that's Department of Health and SAMHSA and DEA. I could get that here. I wouldn't need to get permission from anybody but those 3 entities. But the reason we don't do it here is because it requires a lot of space, and we don't have space.
Okay, the next one is a long one, so bear with me. The Washington State Department of Commerce requires the tribe to accept all patients who are publicly funded. They cannot send anyone away. Do they plan to circumvent this requirement of their grant? If they claim it's not a requirement, what documentation do they have to prove it? Why are they disregarding House Bill 1102? which shows funding for the proposed tribe includes a phrase, a commitment by applicants to serve patients who are publicly funded persons detained under the Involuntary Treatment Act under Chapter 7105 RCW. This contradicts the developer's promise to serve only Clallam and Jefferson counties. So, I mean, in short, it sounds like they're saying you're legally obligated to accept patients outside of Jefferson and Clallam. Is that accurate or not?
Well, my application to Commerce and the contract says, right, service area, Clallam and Jefferson County. I mean,
Okay.
I can't say it anymore with certainty. 100%, we're only going to see Jefferson and Clallam County. It doesn't matter even if I'm not at capacity here. And that was the other argument that likes to be made, that you have a capacity of 250 patients at your clinic, and there isn't that much need here. So because there's no need, you're going to go out shopping for patients in Seattle. I don't need 250 patients to make this work. I can operate just fine with 150 patients. So we don't need to go out shopping outside of the 2 counties that we want to serve.
All right. Next question. Doesn't the managing doctor need to have a specialized license to provide methadone? Isn't that license different from the MAT waiver needed for the primary care MAT at the Fifth Avenue Clinic?
That is a slightly different, and it's not a waiver, it's a certification, but that's because he would be the medical director, and it's our chief medical officer that's the chief medical officer here, would be the chief medical officer there.
Okay.
He could have a program here for it, he could have a whole program there for it.
Okay, all right. Let's see.
It's a medical clinic. I know all these questions are good towards, that's not a medical outpatient clinic, and it is.
Oh, I see. Okay, okay. This question doesn't make sense to me. Maybe it will to you. Are you suggesting that a member of SOS would have no valid input? The service area is a 2-county, 4,000 square mile region. Why should anyone in the service area be excluded?
Yeah, I'm not quite sure about what.
Okay, yeah, I wasn't quite sure about that.
I mean, I guess my point about the SOS was, if I form an organization whose sole goal is to stop you, and that's all it's formed to do, how are they going to sit on a committee and give me advice on how to make something successful when their goal was to stop me?
Okay, okay, gotcha. Let's see. All right, next question. Can you pay off the loan and remove the restrictions to the transfer of the property in trust? Please explain the limitation of your Commerce loan regarding sovereign immunity.
Well, so the Commerce, we can't do anything about that one. That's 10 years. And yes, technically we could pay off the loan early, but why would we want to with the interest rates the way they are? I mean, interest rates are so low, it's almost like free money. So right. we're not going to pay off a loan early when we're getting a loan at the kind of interest rates that we're getting. And so that's the first part. Then the second part, I don't think people understand how hard it is to put land into trust that's not contiguous to other land in trust. It's quite difficult.
And some of my own questions related to that. These loans we're talking about, is this for the facility that's going to be built or the facilities are already operating? Oh, okay.
It's for the facility that's being constructed.
Oh, all right. Okay. Okay. And you mentioned it was kind of interesting, if you didn't have certifications and licenses from the state, you couldn't bill people. Is that?
That's correct, because anytime you operate through the state, you have to prove and show your licensure. They will not put you in the system if you don't have the correct license. Every year we have to put in all the credentials of our providers into the system. Mm-hmm. We have, all that has to be verified. Otherwise, it's fraud. Let's say that you didn't notify them or they didn't find out for a month or two, and you were collecting funds. That would be fraud. A lot of people would go to jail for that.
So I mean, when you're talking about billing people, you're talking about billing the state and the federal government, right? Not
well, and third-party insurance. Insurance companies follow the same rules.
Oh, okay. So insurance companies don't. Okay, but
yeah. So we would have Medicare goes through CMS, Medicaid goes through the state, and then the private insurance just goes to each private insurance. But they all require credentialing and certifications and licenses.
Oh, I see. Okay. So, okay. I was thinking more along the lines of billing the private parties. I mean, do you bill private parties at all? I mean, individuals.
We do. Oh, yeah. Yeah. Even at this clinic, our largest customer base, patient base is Medicare, then Medicaid, then private insurance.
Oh, I see. Okay. Okay, all right. That's where you get most of your funds, and obviously you couldn't operate without those funding sources. Is that correct?
We couldn't operate anything without those funding
Yeah.
sources.
Okay, that's
It'd be impossible.
Okay. Right. Let's see. Will the MAT take court-ordered patients from other counties? I believe the testimony was no before. Is that correct?
Yeah, I believe on our initial application we did not check that box because we have to check the box. Are you going to take court-ordered or not? And we said no in the beginning. We want to get up and running and get on our feet and see if that's something we want to do. And there's been some difficulty with there was in the past with the drug courts here in this county and the MAT program. So we want to be real comfortable with that before we head down that path. If we do.
Although that is something you could change your mind on in the future, right? You could accept them.
We could go back and say we'd like to do that. But it would have to be, you know, the courts and everybody saying, gosh, we really have these patients and we'd really like you to see them. And, you know, we'd have to talk about it and discuss it. But it's not something we're doing out the gate.
All right.
Wow, the number keeps going up.
A bunch of comments. Pardon?
The number keeps going up.
I know. I'm getting near the end of it. They're almost all comments. Let's see. And again, I want to reiterate, this should just be questions right now, not just comments. Okay. All right. I think, let's see. Yep. Those are all the questions then. Wow. And good timing too. So, wow. Oski, I think, yeah, almost made it to exactly to 5 o'clock. So why don't we stop it right here? I think we've had some good testimony today. It certainly helped me, and I hope the community understand better what's going to be happening at this facility and what kind of impacts it's going to have. Mr. Murphy, how many other witnesses were you planning on presenting for tomorrow?
This is it for the tribe. I do have questions for Chief Crane, but that's the only witness for me at this point.
And Ms. Nelson Gross, how many witnesses do you have tomorrow?
Just Ms. Chief Crane.
Oh, okay, great. Okay, so just to advise the public, sounds like we just have one witness left, and you know, that might take an hour or something, or maybe up to 2. But after that, we'll then jump into public comments. Oh, and I should, well, Mr. Murphy or Ms. Gross, did either of you want to do redirects since I did a bunch of cross-examination?
I do have some redirect questions for Mr. Simkoski.
Okay. Why don't we do that tomorrow though? Let's do that tomorrow since we're almost at 5 o'clock. And also I will disclose for the parties because I got an email from Ms. Goldberg and that's outside of the exhibits that were admitted into the record so far. So I'll just disclose, she had said that she plans on not testifying after all because she was satisfied with the information she heard today. She just wanted to make sure, though, that her exhibits were still admitted in the record. I replied back that her documents had been admitted into the record, but what I omitted to say, though, was that I think that the parties may have contemplated that she would be subject to cross-examination on those documents, so that might become an issue tomorrow. I don't know. I'll just let the attorneys, you know, raise that as an issue tomorrow if they want. But Ms. Goldberg, be advised that the attorneys may still want to question you about the documents that you put into the record. So, you know, hopefully you can be there tomorrow to answer any if they need to question you about that. Beyond that, anything before we adjourn for today? No, don't think there's anything. Mr. Simkoski, thank you very much for your testimony and also
Thank you.
Matter. It's been a productive day, and I look forward to seeing you all tomorrow. So have a good evening. Good night.
Good evening.
Thank you, Mr.